Well, focused testing in 7 Auckland suburbs will resume today, with people encouraged to get a Mate Corona COVID-19 swab even if they don't have symptoms. The suburbs are under scrutiny from health officials because of their association with clusters or links to mystery cases. While those missing links are of concern, Prime Minister Jacinda Ardern says they won't necessarily ruin the country's chances of moving alert levels next week.
Of those 17, there's only a handful that we're really worried about, because sometimes the genome sequencing will tell us where they link in and will tell us that there's not many links potentially between them and the last person. So that means that there's a handful that we're honing in on. If we are able to get good testing around the areas where they've been in those suburbs, that helps us give us extra reassurance if we're then not seeing further ones cropping up in those areas.
Counties Manukau DHB Chief Executive Margie Appa is also the Northern Region Health Coordination Centre lead and is with us now. Kia ora.
Kia ora, Susan. I'm Henry Kiakwe.
The situation with the numbers yesterday, were as many people tested as you would like to see?
Well, we saw a really good response yesterday. The data so far, and we're still processing, recorded over 9,000 tests on the 13th, and we had a bit of a lull over the weekend as we'd expect, but certainly we'd like to see testing stay well above the 10,000 daily rate.
Okay, so how does that mean that these surveillance tests played into that? What sort of change did you see as a result?
Well, so we normally see a lull over the weekend, and that's pretty close to what we saw every day last week, where we were seeing a rate of between 8,000 and 11,000 tests a day. The focus today and the rest of the week is really to get testing up in particular areas in those suburbs that the Prime Minister announced, and we've got community testing centres within 5-10 minutes drive of each of those suburbs. So we're really focusing on those areas, as well as trying to keep testing up over the city.
Did you get any positives come back?
No.
Okay.
No.
So in these areas, when you're saying that there are testing centres nearby in all of them, what is the need particularly then for the mobile testing centre?
Well, we are also, so the CTCs are made up of both the permanent sites that we've had before the lockdown, we've added to, and we've also sent the mobiles to set up in areas that might not normally be placed. So we've got at least sort of 1 or 2 sites available for those communities to reach out to. And they're all drive-through, so we do encourage families to bring their kids along as well and they don't need to get out of the car.
Okay. Why is it that you've chosen these specific places?
Well, as the Prime Minister has said, and certainly from our perspective, it's a whole number of factors, including the unlinked positives, cases that have come into Middlemore over the last 7 days that were asymptomatic or had got themselves tested but we were still waiting for results. So we just want to cast our net wide across these suburbs just to make sure that we don't have any cases sitting out there. And we're also mindful that some of the cases that came in last week, while we detected one, they came from large households. There were a number of other people in the household who ended up testing positive. So we want to offer an accessible testing site for these suburbs, and just to make sure that we catch, and that's on the advice of our public health, Auckland Regional Public Health. And
how does it work at these surveillance testing centres? I mean, are people who are walking past them sort of actively encouraged to just come in and have a test, seeing as you're in the area? Are they knocking on doors? What's actually happening?
Well, we're also pushing social media tiles and channels and messaging to the communication and using every form that we can think of that is relevant to the communities that we're targeting. And that includes working through our providers and getting messages out. We have Māori, we have specific communication channels that we're pushing messaging through into these areas.
So does that mean you're not knocking on doors or just having a chat to people who happen to walk past?
Not necessarily. I mean, many of these sites are set up in places which are easy to drive through and walk in, but we're certainly encouraging drive through, particularly if people can bring other household members and everyone can get tested at the same time. The other option for people we do have over 200 general practices that are testing as well, so there's another option for people who may feel uncomfortable about or just want to see their GP.
Is it possible for these surveillance testing sites to be either mobile or indeed to offer vaccinations at the same time?
That is something that we're looking at. We'll probably think about that once we get out of level 4. Certainly at the moment the priority is to get testing, and we've got quite a lot of capacity available, as you heard from Anthony earlier this morning, for vaccination. So it is important that we get to a point where we may be able to offer both. I think we'd take advice from the public health and clinical professions on how that can be done with the same teams and using the same. They're very different processes. So that it certainly makes sense that some people might find that useful. But most people
why would you be waiting until you're out of level 4 to be doing this, especially when Auckland is meant to be having this surge on vaccinations?
Well, if you recall, the testing is generally offered to people who are symptomatic, and people who are coming for vaccination are generally well, and so we don't really want to mix up.
But the surveillance test for the surveillance testing centres, that's not for people who are symptomatic, is it, particularly?
So surveillance testing is often targeted at particular populations, and we have done some surveillance testing during levels 1 and 2 when we're looking for virus or risk of virus, but certainly at the moment, we do need to keep the two groups of people quite separate.
Yes, and so in the surveillance testing centres, that's what I'm asking about. If you're testing people who do not have any symptoms, would it not be a good idea to also offer a vaccine at the same time?
That's a possibility. At the moment, we are focusing those testing sites on testing.
What is the population number for these areas that you are looking at, particularly for surveillance, and what percentage of the population do you need to get this week?
We don't have a percentage target. What we're really looking for is an increase or a lift in the testing from those areas, and we add that. That's one input into looking at what appropriate coverage looks like for the suburbs. So I don't have that information in front of me at the moment, but they are quite large suburbs. I mean, a suburb like Mangere has about 65 to 70,000 people. And we wouldn't necessarily be looking for a percentage of that Mangere population to be tested. We want to see an increase or a lift in that community coming out. We don't have targets for testing.
I appreciate your time this morning. That is Margie Appa, Northern Region Health Coordination Centre Lead, and also Counties Manukau DHB Chief Executive.